Samuel Reed arrived at the hospital on a quiet afternoon when the light was soft and the hallways smelled like clean soap. He was a man who noticed details. He had always noticed them in business, and he noticed them now too. The walls were white. The chairs were neat. The clock ticked a little faster than he liked. He wore a dark blazer even though he felt tired. His steps were slow, but his back was straight. People knew his name because it was printed in magazines before, and also because someone had written VIP on his chart. He did not care about that label. He wanted only peace, not attention. He had already made up his mind. At the front desk, the admitting nurse smiled and asked for his ID. He passed it over with a steady hand. He was polite, as he always was, but he did not smile. She asked a few gentle questions. "Are you in pain right now?" He gave a small nod. "A little." She asked if he had family to call. He paused for a long second. "Not today," he said. It was the simplest answer he could give. He did not want to explain the long story behind it. When he got to his room, the window showed a view of the city. Cars moved like tiny toys. The clouds hung low as if they also wanted to rest. A nurse helped him settle in. He thanked her and asked for quiet. Then he signed the papers that said in clear words that he refused treatment. Comfort care only. He read every line, even though he already knew what it said. He signed, with a neat signature, the same way he had signed contracts for years. He did not shake. He felt sure. He believed more medicine would not help him. He believed the time to fight had already passed. He remembered his wife when he signed. Her name was Elena. Years ago she had gone in for a surgery that was supposed to help. She did not come home. Ever since that day, hospitals felt like cold rooms where warm hands were not enough. He did not blame people, not the nurses, not the doctors, not any single person. He blamed the idea of hope that had turned into pain. He told himself he would never do that again. If the body wanted to rest, he would let it rest. He had money, it was true. He had built a business from nothing. He had started with a small truck and a bigger dream. He worked every day, every weekend, and slowly became a name that people knew. But money did not change the past, and it did not change his feelings about hospitals. He could buy the best room. He could buy a better chair. He could not buy trust. Trust had to grow like a quiet plant, and this building felt like stone, not soil. Dr. Sarah Malik came to see him that afternoon. She walked in with a soft knock. She had a gentle voice and clear eyes that made people feel calm. She stood near the door first, not too close. "Mr. Reed," she said, "I'm Dr. Malik. May I sit?" He nodded. She took the chair and pulled it close enough to listen, but far enough to give him space. She did not rush into medical words. She started with a simple line. "How are you feeling right now?" He said, "Tired and ready to be left alone." She nodded once. "I hear you." She looked at him without judgment. She did not push a plan or a list. She let the room be quiet for a moment. Then she asked, "Would you like me to hear your story? Only if you want." He said, "My story is long and I do not like telling it." She said, "That's okay, you do not have to." She asked if she could check his temperature and listen to his heart. He agreed. Her touch was careful and calm. She noticed that his fever had gone up and down through the day. She heard a small murmur in his chest like a whisper in a hallway. She made a mental note. It did not match the quick label some had put on him. She asked the nurse for the latest lab results and the notes from the emergency department where he had first been seen. She read quietly. Some numbers suggested one thing. Other numbers suggested another. It was not a clear picture. She did not jump to conclusions. She had learned through years of practice that the first story is not always the full story. She also knew that he had refused treatment. That fact was not small. It was the center of the room. "Mr. Reed," she said, "I see you signed comfort-only papers. I respect your choice. I want to make you as comfortable as possible. I also want you to know that if anything feels different, if you change your mind at any time, you can tell me. You do not have to explain. A simple yes or no is enough." He looked at her and asked, "Do you think I am making a mistake?" She took a breath and chose simple words. "I think you have reasons. I want to understand them. I also see a few details that make me wonder if there is more we can check. But I will not do anything without your permission." He appreciated that she answered simply. He did not want a speech. He did not want someone to sell him a promise. He told her about Elena, not in long sentences, just in pieces. She was kind. She baked bread on Sundays. She never raised her voice. We were told the surgery would help. It did not. He stopped there. That was enough for him. That was enough for her too. She did not add a big response. She said, I'm sorry, thank you for telling me." He nodded. The afternoon went on. Nurses came and went with soft steps. They brought cool cloths for his forehead. They adjusted the pillow. They lowered the lights. Dr. Malik ordered small comforts that did not go against his wishes. Careful mouth care so he would not feel dry, a fan set to low, light soup if he was hungry, and scheduled checks of his temperature and breathing just to make sure he was not in distress. She asked for another set of lab tests, but only the ones he agreed to. She chose the least invasive ones. He allowed a small set because he did not mind one more quick draw if it would help with comfort. "Do you like to read?" she asked, noticing a book in his bag. "Sailing," he said. "I liked sailing when I had more strength." She smiled and asked what the water felt like on good days. He said, "Like a big friend that did not ask questions." It made her smile again, and it made him look out the window with a softer face. The city lights were just starting to glow. He had always liked simple lines of light at dusk. They felt like steady hands. At the nurse's station, a young resident asked Dr. Malik, "What do we do if he keeps refusing? The notes say end stage." Dr. Malik kept her voice calm. "We listen. We make him comfortable. And we watch. Not everything fits that label, and labels can be wrong." She did not say this to argue. She said it because it was true in medicine, and because her patient deserved careful eyes. The resident nodded and took notes. It was a small lesson that would stay with him later. Back in the room, Samuel's phone buzzed once. The screen showed a name he had not called in a long time. He let it go dark. He felt a mix of pride and sorrow that he never liked to name. He had always been strong in business. He had not always been strong at home. That was the part of his life he kept folded like a letter he did not open. He did not know if he wanted to open it now. Dr. Malik did not ask about family again. She simply said, "If there's anyone you want me to call, at any time tell me and I will do it." He looked at her and said, "Why do you care so much? You must have many patients." She answered, "I care because you are here and because you are a person, not a number." It was a simple line, but it was full. He believed her. He did not say it out loud, but he felt it in the way his shoulders relaxed. She listened to his lungs again. The sound had a small rattle at the base, not loud, but there. The fever had risen a little since the last check, then dropped, then risen again. It made a slow pattern like a tide. She wrote it down. She asked the nurse to measure it at regular times to see the shape of the day. It was a quiet plan, almost invisible. It did not cross his boundary. It showed respect and also curiosity. In her mind, a small question took shape. Was this only the final chapter, or was there a problem hiding inside the larger story? Something that could be eased without breaking his wishes. When evening came, the sky turned a deeper blue. The city became a field of tiny stars below the window. The room was dim and calm. She asked if he wanted the shade half open or closed. "Half," he said. It felt right, halfway between the world and his bed. She asked if a little music would help. "Only if it is soft," he said. She found a gentle piano station and set the volume low. He let it play. He did not sleep, but his face eased. She stayed a little longer than usual, not because he was a famous name, but because she had a feeling that the right kind of attention could make a difference. She did not talk much. She did not fill the silence with words. She sat with him. When she stood to leave, he surprised himself. "You may come back tomorrow," he said. It was as close to an invitation as he could give. She nodded and said, "I will." Later in the hallway, she typed her note in the chart with care. She wrote what he said, what he refused, what he allowed, and what she observed. She wrote that he was polite and firm, that he had reasons, and that his fever had a pattern that did not fully match the easy label. She did not argue against his choice. She did not promise things she could not promise. She ended the note with a simple plan. Keep him comfortable, keep watching, listen more. Samuel lay awake and watched the city breathe. He thought of Elena and the bread she used to bake on Sundays. He could almost smell the warm air from the oven and hear her quiet laugh. He thought of their last morning together and felt a soft ache, like a hand pressing gently on his chest. He did not like to cry, and he did not cry now. He let the feeling pass through, like a small wave under a boat. He also thought of the dew. The next morning, the hallways were brighter and busier. Carts moved, phones rang, people spoke in calm voices. Dr. Sarah Malik came early, before most rounds. She had a quiet plan in mind. She wanted to check on Samuel before the day put more layers between them. She washed her hands, took a breath, and stepped into his room. He was awake, looking at the pale sky through the half-open shade. He seemed tired, but alert. "Good morning," she said. "How did you sleep?" He said, "Not much, but quiet helps." She nodded and asked if he wanted water. He took a small sip and thanked her. Even in his weakness, he was polite. He still wore his careful manner like a clean coat. She checked his temperature, his pulse, and his breathing. The fever had dipped overnight but was creeping back up. His chest still had that soft, odd sound when she listened with her stethoscope, like a small rattle that did not belong there. She wrote the numbers down, not rushing, not making a face. "I want to keep you comfortable," she said. "I also want you to know I will be honest about what I see." He looked at her with steady eyes. "That is all I ask," he said. It was a simple promise between them. At the nurse's station, a message was waiting in his chart. A note from his lawyer had arrived by email. It was formal and clear, and the lawyer asked that the hospital respect Mr. Reed's refusal and not pressure him. He used words like autonomy and capacity. The lawyer also reminded the team that Mr. Reed was a private person and did not want visitors or calls unless he asked. Dr. Malik read the note carefully. She respected the law. She also knew the law made room for careful judgment when a patient's mind became clouded by illness. But right now he could understand and speak for himself. She had to walk with care. An administrator stopped her in the hallway. He had the soft, careful voice of someone who dealt with risk all day. "Doctor, have you seen the lawyer's note?" She said yes. "Good," he said. "We must not push. Keep comfort care. Document everything." She replied, "I will. However, I also want to request a fresh capacity evaluation. I have concerns about depression and grief affecting his judgment. I am not saying he lacks capacity now. I am saying we should check." The administrator paused. He was not against her, but he feared complaints. "Okay," he said. "If you do it by the book and involve ethics, I will support it." She thanked him. Then she called the psychiatry team to request a gentle, respectful capacity check. She asked them to move slowly and kindly. Before they arrived, she returned to Samuel and explained her plan in simple words. "I want to ask another doctor to speak with you about your decision. This is not to push you. This is to make sure we respect you in the right way. If you ever become confused by illness, we still want to know your wishes." He listened. His face stayed calm, but his fingers held the bed rail a little tighter. "I understand," he said. "I do not promise to change my mind." She smiled a little. "You do not have to. You only have to be heard." While waiting, she went digging through old records. She looked at the first emergency note from when he came in. It said probable end-stage disease. based on his weight loss and some earlier scans from another hospital. But then she found a newer report that was less certain. It mentioned shadows and fluid that could be from different causes. She also looked at blood tests from last night. A few markers suggested there was inflammation or infection. She did not want to overload him with medical terms. In her notes, she wrote simply, "There may be a treatable piece inside this larger story." It was like seeing a small door inside a bigger door. The psychiatry consultant arrived. She was a kind woman with a slow pace and a friendly way. She did not wear a white coat, only a calm smile. She asked Samuel about the date, the place, the reasons for his decision. He answered clearly. He knew who he was, where he was, and what the papers meant. He said, "I do not want more pain. I do not trust that more care will help me. I want comfort." The consultant thanked him and turned to Dr. Malik in the hallway. "He has capacity at this time," she said softly, "but he is also carrying deep grief and guilt. He is not depressed in a way that removes his judgment. Still, if his illness worsens and he becomes confused, that would be a new situation." Dr. Malik nodded. She appreciated the careful words. Right after Dr. Malik called the hospital ethics team, she requested a meeting that afternoon. She sent them a summary. History of loss, refusal of treatment, signs that an infection might be present, and the possibility of a time-limited trial if capacity changed. The phrase time-limited trial meant short, focused treatment to see if improvement was possible, not a long, open-ended plan. She made it clear this would only be relevant if he could not speak for himself, and if urgent care could change the outcome. She wrote everything in clear, simple language so no one would misunderstand. When she returned to Samuel, she brought comfort items first. She adjusted the fan. She offered light soup and tea. She made sure his mouth did not feel dry. She checked the blanket and the pillow. He watched her with a thoughtful look. "You take care of small things," he said. "They matter," she answered. He gave a small nod. Then he surprised her with a question. "Do you ever regret your work?" She thought for a moment. "Sometimes I regret the cases where we could not listen well enough, early enough. But I do not regret being here today." The answer seemed to relax him. By midday, he was more tired. He asked for the shade to be closed. He wanted quiet. Dr. Malik stepped out. A volunteer chaplain came by and asked if he wanted a short visit. Samuel thanked him and said no, not today. A social worker left a note offering to call family if he wished. He did not reply. He kept his world small, as if smallness could make the hard parts easier. He was not unkind. He was guarded like a safe with a number lock that only he knew. Later, his lawyer called the unit and spoke with the charge nurse. The lawyer did not shout or threaten. He simply said, "Please note again that my client refuses treatment. Please ensure no staff make him feel guilty or pushed." The nurse documented the call. She also noted that Dr. Malik had been gentle and had not pressured him. The staff respected Samuel's wishes and also respected the careful way Dr. Malik was moving. It was a narrow bridge, but they were walking it together. In the afternoon, the ethics team met with Dr. Malik in a small room with a round table. She shared her observations, the fever pattern, the chest sound, the lab hints. She described his clear refusal and the reasons behind it. She explained the psych opinion. Capacity now, but grief present and confusion might come if he worsened. She proposed a plan written in plain words. If he lost the ability to understand and decide, and if urgent care could help, they would consider a short trial of antibiotics and urgent drainage to treat a possible infection. After a set period, they would reassess. If no benefit was seen, they would stop and return to comfort only. The ethics members asked careful questions. They wanted to make sure the plan respected both values, his autonomy and his welfare. After discussion, they agreed the plan was reasonable if documented clearly and if the on-call legal officer was notified in real time, should the situation change. When she returned to the floor, Samuel was awake and a little restless. His hands were warm. His forehead felt hot. The nurse had just charted a higher temperature. Dr. Malik sat down and spoke softly. "Your fever is up a bit today," she said. "Do you feel more chills?" He said. "I feel like the room is shaking, but I know it is not." She nodded and brought a cool cloth. "This should help." He closed his eyes and let the cloth rest on his skin. He did not pull away. He allowed help in these small ways. In the early evening, he asked for his blazer. He wanted to sit up, on the edge of the bed, and feel like himself. The nurse helped him. He looked at the window, then at his bag. "I am thinking of leaving," he said. "I could sign out." Dr. Malik did not panic. She did not raise her voice. "If you wish to leave," she said, "we will help you understand the risks and arrange safe transport. We will also send comfort medications to the pharmacy you choose." He looked surprised that she did not argue. Her calm tone made him pause. He asked for a little time to decide. She said, "Of course." As the sun went down, his fever spiked. It came like a silent wave. His face flushed. His hands trembled. The nurse checked his temperature again and called Dr. Malik. The number was higher than before. His breathing grew faster for a short period, then slowed, then sped up again. A set of blood cultures that he had agreed to earlier came back with early signals that hinted at a spreading infection. The lab phoned the unit. Dr. Malik listened, thanked them, and wrote down the details. She stood by his bed and spoke in a steady voice. "Mr. Reed, your body is working hard right now. I will stay with you." He nodded, though his eyes looked far away for a moment, as if they were following a memory rather than the room. He became a little confused as the evening deepened. He called her by the wrong name once, then corrected himself. He asked where the boat was, then shook his head and closed his eyes. Dr. Malik did not make a scene of it. She asked short, simple questions to check his clarity. He could still say his name, but he struggled to track time. He said the year, correctly, then guessed the wrong month. She wrote it down. She did not call it a loss of capacity yet. She called it waxing and waning confusion. She asked the nurse to low. The night grew deeper and the hospital slowed down. The lights in the hallway were low. The clock kept its steady sound. Inside the room, Samuel drifted in and out of sleep. Sometimes he whispered, sometimes he sighed, sometimes he called a name that did not belong to the present. He said Elena once very softly, as if the word itself could keep him safe. The nurse kept a quiet watch, checking his temperature and pulse without waking him fully. The numbers made a pattern that felt wrong. The fever rose, dipped, and rose again like a wave that would not break. The nurse sent a message to Dr. Malik. She was already nearby. When Dr. Malik walked in, she moved with calm steps. She greeted the nurse in a low voice and stood by the bed. She watched Samuel's chest rise and fall. She touched his wrist and counted the beats. His skin felt hot, then cool, then hot again. She listened to his lungs and heard that same soft rattle, a bit stronger now, like a faint shake of pebbles at the bottom of a stream. She asked, "Mr. Reed, can you tell me your name?" He opened his eyes, slow and heavy. "Samuel," he said clearly. "And where are you?" she asked. He looked at the ceiling. "On the water," he answered, then frowned. "No, a room." She did not correct him with sharp words. She simply said, "Yes, a room at the hospital. I'm here with you." She pulled the chair close and sat. She spoke in short, simple lines so his mind would not have to climb. "Your body is fighting something," she said. "It is working very hard. I will stay and help you breathe easier." He nodded, but his eyes wandered as if they were following a memory across the wall. He whispered, "Sails down," then went quiet. A lab call came to the unit. The nurse answered and handed the phone to Dr. Malik. The lab tech spoke in careful words. The blood cultures that had been drawn earlier showed early growth. It was not final, but it hinted that germs were present in the blood. The tech also read out new results that suggested swelling inside the body and strain on the organs. Dr. Malik thanked the lab and wrote the details in her notes. She looked at Samuel and then at the nurse. "We will keep him comfortable," she said, "and keep watching closely." In the next hour, Samuel's confusion grew. He asked for his blazer again and then pushed it away, saying it was too heavy. He asked if the window was open, even though it was not. He tried to sit up fast and became dizzy. Dr. Malik guided him gently back to the pillow and spoke in a calm rhythm. "Breathe with me," she said. "In and out." He followed her, voice for a while, and settled. But when she asked the date again, he said the wrong month and could not correct himself. He looked at the clock and called it a radio. He could still say his name, but the rest was drifting. The room felt like a small boat on rough water. Dr. Malik closed her eyes for a second and made a decision. She called the ethics team's on-call member and the on-call legal officer, just as they had planned in the meeting earlier. She gave them a clear update. He is now showing signs of confusion that affect his understanding. He cannot track time or place. His fever is higher. His blood tests suggest a serious infection. He is not able to weigh choices right now. She did not speak fast or slow. She spoke clearly. The ethics member asked a few questions. The legal officer asked if she had documented his earlier capacity and refusal, and if a time-limited trial was agreed upon in principle. She answered yes to both and explained again that the plan was short and focused. Start proven treatment for infection, watch for improvement, then reassess soon. The ethics member said, "Given your notes and his current confusion, you are within the plan. Proceed and keep us updated." The legal officer said, "Document your assessment of capacity loss and the emergency need. Notify administration." Dr. Malik thanked them and hung up. She called the senior administrator on duty, a careful man who handled hard decisions at night. He listened and said, "Are you certain he lacks capacity now?" She said, "I am certain. He cannot understand or weigh information at this moment. The labs and signs point to a treatable infection. Delay could harm him." There was a pause. Then he said, "Proceed with the time-limited trial as discussed. Keep me informed." She turned to the nurse. "We will begin now," she said. "Please prepare IV access, fluids, and the first dose of broad antibiotics. Call respiratory for support at the bedside. Order a chest X-ray in the room. And let's alert interventional radiology on standby in case we need to drain fluid." The nurse moved fast but steady. She was relieved to act with a clear plan. The respiratory therapist arrived and set up gentle oxygen support. The portable X-ray team rolled in with a quiet machine and took an image while Samuel lay still, his eyes half open. As the orders went in, a junior doctor hesitated. "Doctor," he said. He signed a refusal. The lawyer sent a note. "Are we sure?" Dr. Malik nodded. "We are not ignoring his wishes. We are protecting his welfare in a moment when he cannot speak for himself. This is a short, careful trial. If it does not help, we stop and return to comfort only. Our notes are clear. Ethics and legal are informed." The junior doctor took a breath and said, "Understood." He felt both nervous and grateful to see how calm planning looked in real time. The antibiotics were started. The first drip began to move like a narrow stream into Samuel's vein. He stirred and winced a little. Dr. Malik leaned close. "This medicine fights the germs," she said in a soft voice. "You are safe. We are here." He relaxed. She ordered gentle fluids to support his blood pressure, nothing too heavy. She checked his breathing and asked the respiratory therapist to coach him with slow, guided breaths so his lungs could open more. The therapist spoke in a kind rhythm, and Samuel followed like a tired swimmer learning to float again. The X-ray image loaded on the portable screen. It showed a hazy area at the base of one lung, and there was a note about fluid that should not be there. It might be part of the infection's cause or effect. Dr. Malik called the radiologist on duty to read it in more detail. They agreed. Fluid was present and it could be drained if his numbers allowed. She asked interventional radiology to prepare. but only if he stabilized enough to tolerate the procedure. She did not want to push. She wanted the safest path. A senior administrator arrived at the doorway, looking serious but not hostile. He saw the calm order in the room, the nurse at the pump, the respiratory therapist by the bed, the portable X-ray folded aside, the doctor at the chart. He stepped in and said, "Dr. Malik, may I speak with you in the hall?" She joined him for a minute. He asked a set of careful questions to be sure the process was followed. She answered each one with clear notes and times. Ethics call at 12:47, legal at 12:50, documentation done, capacity reassessed at 12:40 showing loss, antibiotics started at 12:58, chest X-ray reviewed, interventional radiology on standby. Her voice was steady, her eyes kind. He nodded. "Proceed," he said. "I stand with you." Back in the room, the nurse said, "His fever is still high, but his breathing is a little more even." The numbers on the monitor showed small steps in a better direction. Not a victory, but a sign. Dr. Malik placed a cool cloth on his forehead again and adjusted the fan. She kept talking to him in simple words, even when he did not answer. "You are doing well," she said. "Stay with your breath, we are here." An hour passed, then another. The antibiotics kept flowing. The fluids gave a quiet support to his circulation. The respiratory therapist adjusted the oxygen and coached him kindly. The nurse repeated checks, not missing a beat. The room felt like a well-practiced team rowing a boat together across a dark lake. Near dawn, the interventional radiology team arrived with gentle voices and a small ultrasound machine. Samuel looked more settled, though still weak. Dr. Malik leaned close. "We will remove some fluid to help your lung," she said. "It should help you breathe." She explained what would happen in simple steps. Clean the skin, a small numbing medicine, a thin tube, a careful drain, and then a dressing. He did not answer in full sentences, but he did not pull away. He sighed and nodded once, a small yes that belonged to the present moment more than to any earlier paper. The team worked with care. The ultrasound image showed the pocket of fluid, and they chose the safest path. The numbing medicine went in and did its work. The small tube slid gently where it needed to go. The fluid began to drain, slow and steady. The nurse watched the collection bottle fill with a pale color that did not belong in a lung. The respiratory therapist watched Samuel's chest, and slowly, his effort eased. The radiology doctor said, "Almost there," in a quiet voice. Dr. Malik kept her hand on the bed rail and her eyes on Samuel's face. She spoke to him like a friend on a long walk. "You are safe. We are here." When the drain was complete, the team cleaned the area and placed a neat dressing. They stepped back and checked the monitors. Samuel's breathing was smoother. His face was less tight. His fever had not broken yet, but it was lower than before. He blinked and focused on Dr. Malik's face for a few seconds. "You stayed," he whispered. She smiled. "Yes," she said. "We stayed." The administrator came back with a question still hanging on his lips, then stopped when he saw the change in the room. He looked at the nurse, the therapist, the doctor, and the patient. The tension in his shoulders let go a little. He said, "Keep documenting. We will meet in the morning." Dr. Malik nodded. "Thank you," she said. He left with a quiet X being simple and saint. The morning light came in gently through the half-open shade. The room was quiet except for soft beeps and the whisper of the fan. Samuel slept for a while with his mouth slightly open, like someone who had carried a heavy bag and finally put it down. When he woke, he blinked at the ceiling and then at the window. His eyes were clearer than they had been in the night. He took a slow breath. It did not feel easy, but it felt easier. He waited for the rush of confusion that had covered him like fog. It did not come the same way. He could say his name in his mind. He could count the steps of his breath. He knew. He was in a hospital room. He felt like a man who had been in deep water and was now close enough to see the shore. Dr. Malik stepped in with a soft knock. She looked thoughtful and calm, but there was a careful hope in her eyes. "Good morning," "Mr. Reed," she said, "how do you feel?" He did not answer right away. He touched the edge of the dressing at his side with his fingertips. It was clean and neat. He remembered a small tube, gentle voices, the feeling of pressure, then a slow release. He remembered the cool cloth on his forehead. He remembered a voice that said, "You are safe. We are here." He remembered saying, "Stay." His eyes filled not with tears but with a quiet and heavy kind of thanks that he did not yet know how to say. "What did you do?" he asked, not angry at first, only curious and a little careful. She sat down. "You had signs of a serious infection," she said. "In the night you became confused. You could not understand where you were or what time it was. That meant you did not have capacity in that moment. We started a short, focused treatment to fight the infection, based on the plan we set with ethics and legal. We also drained fluid from around your lung to help your breathing." She spoke in simple steps, like stones across a stream. He followed, each one. His face changed. He remembered the papers he had signed. He remembered the lawyer's note. He remembered saying, "No." For a few heartbeats, anger rose like a spark. He lifted his chin. "You went against my refusal," he said. The words were steady, but not loud. Her voice stayed warm. "I respected your refusal while you could speak for yourself. In the night, you could not. The law and ethics make room for action then, if it is likely to help and is limited in time. This was that kind of action. I wrote down every step. The administrators know, the ethics team knows. If this had not helped, we would have stopped and returned to comfort only." She let silence open a little. "How do you feel right now?" she asked again. He looked at his hands. They shook less. He felt tired, but he could breathe without that hard edge. He did not want to say the word better, but his body said it for him. He let out a long breath and looked at her with quiet eyes. "You stayed," he said. She nodded once. "Yes." He turned his head toward the window. A small line of light lay across the sill like a piece of ribbon. He stared at it for a while and then said, "Thank you." It was a simple line, but it carried weight. Soon after, the unit became busy with morning rounds. The senior administrator came by with a careful face. He asked to speak with Dr. Malik at the nurses' station. He was not hard, but he was thorough. "We will open a routine review," he said. "This is standard when we act in a gray zone. I want to understand every step." Dr. Malik agreed. "Of course." Nurses gathered their notes. The respiratory therapist signed her chart. The EOSMA interventional radiology doctor sent a clean summary. The junior doctor who had hesitated wrote a clear line. Capacity lost at 12:40 a.m., ethics and legal notified, time-limited trial, antibiotics started, drainage performed with benefit, reassess ongoing. In the room, the nurse helped Samuel sit up a little more. He asked for warm tea and a small piece of toast. He ate slowly. He was calm. He was also thinking. He looked at his phone, which lay on the table like a familiar book he did not know if he wanted to open. He touched the screen and saw a name he had avoided for months. He put the phone face down. Then he turned it over again. He did this twice, like a man testing the water with his foot. The nurse said nothing. She brought more warm tea and adjusted the pillow. Dr. Malik returned and pulled the chair close. "We have two paths," she said. "We can stop the antibiotics now that you are clear again and return fully to comfort-only care. Or, given your improvement, you can choose to continue this short course to complete the treatment for infection. We would still focus on comfort and keep the plan simple." Her words were plain and kind. She did not push. She offered a choice like a steady hand. He asked, "Will this cure everything?" She answered, "No. It will treat the infection that was making you sicker. It will not change other long-standing problems in your body, but it can give you more clear time, more comfort, and possibly more days of ordinary life. I cannot promise a number. I can promise to be honest and to stop any treatment the moment you say so. He listened and closed his eyes. He pictured Elena at the oven on a Sunday. He pictured a small table by a window, a warm slice of bread, steam rising. He pictured a phone call he had not made. He opened his eyes. "Continue the short course," he said. "We will reassess in a few days." His voice was soft but firm. Dr. Malik nodded. "I will write that down." By late morning, the review meeting took place in a small conference room. The administrator sat at the head of the table with a tidy stack of papers. The ethics representative joined, as did a legal officer by phone. 2 nurses came to speak and the respiratory therapist too. Dr. Malik presented the timeline with calm clarity. She did not make it dramatic. She did not make it small. She told the truth in simple lines. Earlier refusal with capacity, deep grief known, signs of infection, sudden confusion at night, clear loss of capacity at a specific time, calls made, plan followed, short evidence-based treatment begun, improvement seen, patient now clear again and choosing to continue a short course. The administrator asked questions that were exact. "Were any staff members disrespectful or pushy?" "No," said the charge nurse. Dr. Malik spoke gently and respected comfort at every step. "Were notes complete?" "Yes," said the junior doctor, sounding steadier now. "They were complete and time-stamped." The ethics member said, "This is the kind of case our policies imagine. Respect for refusal while the patient has capacity, and protection in the moment capacity is lost, when short, proven actions can help." The plan was followed. The legal officer said, "Documentation and calls meet the standard. I advise we support the care given." When Samuel was told there would be a review, he did not feel fear. He felt curious. He was a man who had run meetings for decades. He knew how review felt from the other side. He almost smiled at the thought that now he was the case on the agenda. He said to Dr. Malik, "Do you need me to speak?" She answered, "Only if you wish. The review is about process, not blame." He nodded. "Good," he said. "I have no blame to give." Test results continued to arrive during the day. The blood culture identified the germ. The antibiotics chosen were the right match. A later chest image showed less fluid than before and cleaner lines at the base of the lung. The lab markers for swelling and strain began to fall, slowly, like a tide going out. The team moved with steady care, not with cheer, but with a calm kind of happiness, the kind that shows in quiet eyes and patient hands. In the afternoon, Samuel looked at his phone again. He picked it up and scrolled to a number he knew well. He hesitated. His thumb hovered. He closed his eyes and thought of a voice he had not heard in months. He thought of a young boy with a toy boat and a big smile, and of a man with the same eyes but a harder jaw. He pressed the button and lifted the phone to his ear. It rang 3 times. "Hello?" said a voice. It was his son. For a second, Samuel could not speak. He was a man who had given speeches to rooms full of investors, yet now he held a small phone and had no words. The voice said again, "Hello?" This time it was softer, more careful. Samuel found his voice. "It's me," he said. "Dad," said the voice. It was not angry. It was not sweet. It was honest. There was a pause and then his son said, "Are you okay?" Samuel said, "I am in the hospital. I have been stubborn. A doctor stayed with me. I want to talk." The silence on the line changed shape. It became a bridge, not a wall. "I can come," his son said. "Today?" Samuel looked at the window. He said, "Yes." When his son arrived, he stood at the doorway first, as if he was stepping into cold water and wanted to feel it with his toes. He was not a child. He was a grown man with lines at the corners of his eyes and a careful way of holding his shoulders. Samuel lifted a hand. His son came near and took the hand in both of his. They did not rush to fix the past. They did not list old hurts. They spoke about the present. They spoke about bread on Sundays, and about a boat, and about the phone calls. they had not made. They promised only small things: to send a morning message, to share one old photo a day, to stand on the same side of the kitchen counter next week and make toast. Dr. Malik stood back and let them have the room. She watched from the hall with a gentle smile. The nurse walked by and squeezed her shoulder for a second. It was a small thank you from one steady hand to another. The administrator came later with the review note in his folder. He spoke to Dr. Malik in a low voice. The review finds that you acted within policy and ethics in an emergency. Documentation was strong. We will refine a few for future cases. Espèce. Samuel's last days in the hospital felt like a slow morning after a long storm. The loud parts were over. What remained were careful steps, simple meals, and kind people who knew his name. He still tired easily, but he could breathe without fear. He did not want to celebrate. He wanted to understand. Each day he asked small questions and listened to simple answers. He learned to accept help in ordinary ways, like letting a nurse straighten his blanket, or letting a physical therapist hold his elbow for a few steps. He had never liked the idea of needing others. Now he saw that needing others was not weakness. It was human. He wrote short notes in a small notebook he kept by the bed. The notes were not business plans. They were reminders of feelings and promises. Call my son each morning. Thank the night nurse with the bright scarf. Send bread to the unit on Sunday. Ask Dr. Malik about the pattern she saw. He kept the notebook because memory felt soft, and he did not want the new good things to slip away. One afternoon, Dr. Malik came in with discharge papers and a gentle smile. We are planning to send you home tomorrow if your numbers stay steady, she said. You'll complete the antibiotics and have follow-up checks. We'll keep it simple. He nodded. The word home did not mean the same as before, but it was still a good word. Will I see you again? He asked. She smiled. Yes, I'll see you in clinic next week. And you can call if anything feels wrong. He liked that she never used big promises. She used clear lines. He trusted that. He had one more task before leaving. He wanted to write a letter to the staff. He asked for a pen and sat for a long time with blank paper. Then he began in slow, tidy script. To the team who stayed, he wrote, Thank you for treating me like a person, not a headline or a bank account. You kept comfort first and told me the truth in simple words. You stayed when the night was long. I will not forget. He signed his name and added a line at the bottom. Bread on Sunday. He asked the nurse to place the letter in the break room. The nurse promised to do it. That evening, his son returned with a paper bag from the same bakery. They shared warm slices and spoke quietly about the home routine. They made small plans, a short walk in the hallway each morning, a simple breakfast, a check-in message at noon. His son said he would take a few days off to help. Samuel accepted with a small nod and a soft thank you. He did not want to lean too hard. He also did not want to be proud in the wrong way. They were building a new habit together, brick by brick. The next morning, he went home. The sky was clear, and the air outside the hospital felt like a kind friend. A home health nurse visited in the afternoon and checked the medicines. She wrote a neat list and stuck it to the fridge. Call if you feel chilled, short of breath, or confused, she said. He said he would. He kept the list where he could see it at breakfast. During the first week at home, he had a few uneasy moments. One night he woke sweating and thought he saw a wave at the foot of his bed. He remembered the hospital and the steady voice. He sat up, drank water, and breathed slowly. He told his son in the morning, and they decided on a plan. If the fever rose, they would call. It did not. He ate light meals, walked to the window, and sat in a chair with a book about sailing. He did not rush back to work. In fact, he did not open his email. He opened his notebook instead. At his follow-up, Dr. Malik met him in a bright clinic room with a small plant on the windowsill. She reviewed his tests. The numbers showed a better picture. You're healing, she said. We'll finish your medicines and keep watching. He thanked her and then did something he had not done in a long time. He asked for advice that was not medical. How do I use my days well now? She did not reach for a grand answer. Use them with people, she said. Use them in small, kind ways. He wrote that down like it was a prescription. In the weeks that followed, he began to make quiet changes. He called a community center near the hospital and asked about grief counseling for families who had lost someone in care. He listened to a counselor explain how a little funding could help them keep a waiting list short and a room warm. He agreed to support it. He did not ask for his name on a wall. He asked for steady chairs, soft lights, and tea for visitors who needed both hands free to hold tissues. Make it gentle, he said. He also spoke with the hospital foundation. He explained an idea he had been turning over in his mind. I want to fund a small program, he said, to help teams reassess capacity when illness causes confusion. I want it to teach how to listen for grief and how to use time-limited trials the right way. Simple checklists, fast ethics calls, clear scripts for families, not big, just practical. The foundation director listened with a thoughtful face and said, "We can do that." They called it the Patient Voice and Capacity Program. He made the first gift and asked only for updates that told stories, not only numbers. The hospital's policy team added the new handrail to their stairs just as they had planned. They shared Dr. Malik's case without names in a teaching session. She stood at the front of the room and spoke in plain language about that night. She did not make herself a hero. She talked about preparation, notes, calls, teamwork, and respect. She said the word steady more than once. Nurses nodded. Residents wrote the steps in their notebooks. The ethics member added a line about grief not removing capacity, but shaping it, and about the need to see each person's story, not just their lab values. The legal officer added a reminder about documenting the time of capacity loss and the time of each call. It was not dramatic. It was useful. People left with new tools. A few months later, Samuel walked more easily. He could not climb long stairs, but he could walk around the block with his son on a clear evening. They did it slowly and watched the light in the windows. They made toast on Sundays and sometimes cut it into strong little squares like his wife used to do for their boy. He did not speak the word hope very often. He used steady as he liked. The word felt honest. One day, he returned to the hospital, not as a patient but as a friend. He carried a box from the bakery and a short letter for the staff. He did not want a tour. He wanted to leave the box in the break room and go. But a nurse with the bright scarf saw him in the hall and called his name with a happy laugh. Soon 2 more nurses joined, and then the respiratory therapist, and then the junior doctor who now looked more sure of himself. They stood together and exchanged simple words that meant a lot. How are you? Better? How's your son? We talk every morning. How's your breathing? Steady. They smiled. He left the box and the letter and walked out with a full heart. Before he left the building, he stopped by the clinic to see Dr. Malik. She was finishing a note. She looked up and smiled. He handed her a copy of the letter he had brought for the staff. I said you all treated me like a person, he told her. You did more than that. You helped me treat other people like people again. She shook her head softly. You did that, she said. We only made space for it. He thanked her. He did not add more words. He did not need to. At home, he sat at his small table by the window with his notebook open. He wrote lessons at the top of a page. The word looked too formal, so he crossed it out and wrote things that helped. Under that, he wrote simple words. Steady hands, write things down, ask for help early, bread on Sunday, call in the morning, sit with people and be quiet. He closed the notebook and rested his hand on it like it was a small box full of light. On a clear morning not long after, he woke before the sun and felt like taking a short ride. His son drove him to a nearby park where the benches faced a quiet strip of water. They walked slowly to a bench that had a view of small boats with their ropes neat and their masts still. They sat without speaking for a while. The air smelled like wet wood and grass. A bird made a small sound in a tree above them. The light began to change, soft at first, then brighter. Samuel spoke in a low voice, not for the crowd, not for anyone passing by, but for the woman he still loved. "Elena," he said, as if the name itself was a safe harbor. "You baked bread on Sundays. We forgot that for a long time. We remember again now." He told her in simple lines about the doctor who stayed, about the night of confusion, about the careful hands that did not push but protected, about the letter, about the program at the hospital, about the small room where families could sit and cry without being alone, about the phone calls with their son, about the warm loaf in a brown bag, about the morning messages that said "good day" and meant it. His son did not interrupt. He looked at the water and kept his hand near his father's, not gripping, just close enough to say, "I am here." The sun lifted a little higher and made a path of light across the surface. It looked like a road made of gold, but a quiet kind of gold. Not loud, not rich, just warm. Samuel breathed in and out, slow and even. He did not count. He did not plan. He simply sat with the person he loved in his mind and the person he loved at his side. He felt the shape of his life differently now, less like a sharp mountain to climb, more like a small boat to guide with care. He would still have hard days. He would still have limits. But he also had a way to move through them. Simple words, steady hands, and people. On the way back to the car, he stopped for a moment and looked at the trees. He spoke once more softly. "I promised to Lo,